when we talk about water terrorism, this is also a very important point to be discussing when it comes to chemical agents in the water. Again, if you're looking at water terrorism, there's a huge, massive potential array of chemicals that could be used, whether they're chemical warfare agents, and there have been many effective water contamination events that have started in a local hardware store. Industrial and agricultural compounds that we use every day can be just as effective in causing a huge amount of problem in a water system and making people very ill. Somewhere between 84,000 chemicals and 100,000 chemicals that we use commercially in the world every day. Massive, broad range of toxicity and symptoms profiles and health effects. So you can see as a clinician at the other end, it's a big challenge to anticipate how to diagnose a patient and how to manage it. So the spectrum, again, of these health effects can be very, very, very broad. Chemical contamination of water is its own specific challenge. Another strategy that I think is important for you to remember is, of course, nothing's ever simple in the world, right? It's not just the water's contaminated with biological agents. It's going to be contaminated potentially with both multiple chemical agents and biological agents. This is a photograph from Katrina. This young woman was in the water for a day and a half. You can see the oil slick that she's walking through, in addition to God knows all the pathogens that she was exposed to for that period of time. So again, the challenge for Dr. James and I, pathogen exposure on top of chemical exposure. So you may have very confusing symptoms. People may come in with acute symptoms that mimic the biological pathogen they've been exposed to, and then they may have more long-term symptoms from the chemical agents that were in the water. So again, just to give you an idea of the challenges that we face, we may have both of those issues to deal with when we're dealing with public health. Water terrorism is also an extremely important strategy from a terrorism point of view. Okay, I have 4 minutes. I'll try and get through most of this. How about 10? How's that sound? Okay. I want to get through some of these other strategies, and I'll move through quickly here. So again, we have a lot of various issues here where you have multiple. You may have biological, chemical, and radiologic component exposure. And the problem with this is these are not detectable by the human senses. So it's frequently colorless, odorless, and tasteless. So if there was a water terrorism event, people may be ill and not even know that they've been exposed because they're not going to be aware that their water tastes differently, looks differently, and has any of the characteristics that would give them an indication that it had been contaminated. Another really important point I want to make is that all localities are at risk. Populated areas and rural populations. Water systems in rural areas are equally at risk as large cities like New York City. Everyone's at risk for these kinds of events. This is an example for Hurricane Katrina, Burris, Louisiana, tiny, tiny town. It was the eye of the storm. That's their water tank. They no longer have water infrastructure, just as susceptible as anyone else. And interestingly, this applies to water terrorism as well. A small outbreak of terrorism-related disease in a community may be a testing ground for a larger scale attacks. There's been some evidence that this is indeed what some terrorists have been thinking about, testing their systems out in small communities. So I always say everyone's at risk of small or large community. Again, another really important point I want to make is you really need to be careful and remember that you'll need significant capacity to take care of a lot of sick people who may be very, very ill all at the same time. Because if you're distributing a contaminant in a water system, potentially thousands of people are exposed to it at exactly the same time. So several examples in the United States occurred where we had 4,000 residents all ill in a small community all on the same day. I don't know how many hospitals could tolerate 4,000 hospitalized patients in one day. Huge strain, very difficult challenge. And they're going to be very seriously ill. This little girl from the Canadian toxic E. coli outbreak ended up developing a very serious disease called hemolytic uremic syndrome. She was helicoptered out to a specialty clinic, and it eventually still did lead to her death. People are ill very quickly with very serious disease. So you may need to have as much as in your planning as possible. Again, remember you're going to have very ill people all at the same time. What kind of emergency intervention do you have, and can you get them out to other facilities quickly? So talking about emergency evacuation is very important. Another important point, you need to protect your aid workers, your water infrastructure folks, your public health folks. They are at increased risk. Why? Because they were in the water all the time rescuing everybody else. I find this to be a huge gap in many plans. Worker protection is often overlooked. They are the ones that are going to be in the water potentially for weeks at a time. Really important for you to think about protecting them on the front end. This is a great photograph from New Orleans again, where the appropriate amount of emergency medical special protective equipment, the washdown, so that these folks were taken care of every night when they finished their time in the water to make certain that they were able to be decontaminated. Very important to remember the people that we're putting out in the field to rescue everyone else. Another important point, you need to think about both short and long-term consequences. Just because the water recedes doesn't mean that you're not going to have long-term consequences for weeks or possibly even years relating to water contamination and medical consequences. This looks like an angry crowd, doesn't it? You need to really prepare for providing credible and timely risk communication to the public when there's a water contamination event. And I always recommend you have a physician and a public health person on your side on the front end if you're a government authority. This is a photo of a prime minister in Canada addressing very angry citizens. It says, "We demand answers," and that little sign in the back. This was a community, their water contamination in the water system resulted in several deaths in their community. They were very angry. So including physicians in your risk communication during and after an event is very important.